Hey,
Namaste. Good afternoon, everybody. I, Dr. Suhas Kumar Shetty, the Dean of Research and Organizing Secretary of E Samshodhana 2020, welcome you all for the fifth scientific session of 10 days international webinar on the theme Opportunities and Challenges in Medical Research. This event is proudly organized by Rajiv Gandhi University of Health Sciences as part of Silver Jubilee celebration and is proudly hosted by Department of Research and Development, SDM College of Ayurveda and Hospital, Hassan. This is a 10 days program from 19th to 28th of August, and today happens to be the fifth day of this webinar. In the past 4 days, we have discussed about various opportunities that I come across in medical research, especially in traditional Indian medicine, and it has been discussed by various eminent speakers across the globe. Along with the opportunities, we also come across various challenges in research, and especially when it comes to the comprehensive, holistic, and traditional medical system like Ayurveda. I'm very happy to share that in today's session, we have two of the most renowned faculty and experts in the area of research. Let me welcome Professor Rajesh Shenoy, Syndicate member, Rajiv Gandhi University of Health Sciences, Bangalore, who will deliver the keynote address in today's session. A warm welcome to you, sir, on behalf of the organizing committee. I also welcome Dr. P. Ram Manohar, Research Director, Amrita School of Ayurveda, Kollam, who will be enlightening all of us on the topic Research Challenges in Ayurveda. I welcome you, sir, on behalf of the committee. A warm welcome to you, sir. I also welcome our beloved principal, Dr. Prasanna Endra, who has been the guiding source for all our activities. A warm welcome to you, sir. I welcome all the participants, delegates, organizing committee members, faculties, students of our institution for today's session. We'll begin today's session with a keynote address. Let me take this opportunity to briefly introduce today's keynote speaker, Professor Rajesh Shenoy, a very committed, dedicated, hardworking personality at Rajiv Gandhi University of Health Sciences. Professor Rajesh Shenoy, a postgraduate in medical microbiology from Kasturba Medical College, Mangalore, is presently the Honorable Syndicate member, Rajiv Gandhi University of Health Sciences, Bangalore, and also the Director of Padma Shri Group of Institution and Medicare Private Limited, Bangalore. Padma Shri Group of Institution has more than 10 organizations offering quality education in various allied health sciences like physiotherapy, MLT, etc. In fact, Padma Shri College of Physiotherapy set up by him was the first physiotherapy college of Bangalore. presently holding the post of Syndicate member of Rajiv Gandhi University of Health Sciences since July 2019, and also the Dean of Allied Health Sciences and Physiotherapy, member of Academic Committee, and member of the Expert Committee of Research Proposal Grant, member of Board of Studies of Allied Health Sciences, Rajiv Gandhi University, advisor of HKS International School, and many more. To mention a few of his achievements, Sir was a convener for the committee to formulate the draft status of Rajiv Gandhi University Act regulating to classification of teachers of university and affiliated colleges. Sir was very instrumental in formulating and implementing of various new syllabus under his tenure during the chairmanship of Board of Studies. It is our indeed honor and pleasure, sir, to have you on today's occasion. May I now request Professor Rajesh Shenoy to kindly deliver the keynote address. Over to you, sir.
Thank you, Dr. Suhas. It was so kind of you to those encouraging words. Let me start off. I don't want to waste much of my time. I'll just have a small presentation based on the feedback what I had while I was sitting on the research advisory committee of RGUHS. So basically, I have listed out a few things which tells do's and don'ts of the research, what you need to do and what you need to look after. So as I told you, imagination is more important than knowledge, and knowledge is limited. Imagination encircles the world. This is what the basic idea whenever somebody goes for a research. But the main thing what we need is you need to be selecting a innovative topic which should be unique, and we do not encourage funding projects which have been already carried out. Basically, what we see with the people from Ayurvedic background coming out is you need to do a little bit of research and check whether some of these projects have been done somewhere else earlier. Please look into that so that there is no duplicity. We will not be selecting a topic which is already taken for a PhD study. And PI needs to be having a co-PI also so that we can take them whenever if there is an unforeseen circumstances, PI has to leave, the co-PI can take over these investigations or research what is going on. Candidates who are doing PhD can be taken up as junior assistants. And we have an online format where you can submit the application guidelines whenever the university calls for. There are detailed guidelines and time frame is present. We give 2 years time frame for all the research projects which are under RGUHS. And budget needs to be very precise, and what is to be added in the inclusions also is very clearly mentioned. And the research assistant cost and all payment should not cross 30%. A lot of these criteria are in detail mentioned. Then we do not encourage purchase of any equipments. The money what is being given to you is purely for doing research. So please don't invest on unwanted equipments and all because university doesn't permit it. Material collection, this is more important for Ayurvedic people, especially when you go in for a project which involves material collection, external resource or something like that. You need to plan in advance investigations if you do and need any test, and transparency is expected from all of you, because if some of your colleges are having labs and all, see that the tests are done at your lab so that you can minimize the cost, because these funds are given by university. Especially coming to the material collections, I have seen a lot of Ayurvedic people, especially who go for the plants and all, you need to take prior permissions from the forest department or concerned departments to get these things. So please see that these are done in advance. Once the project is sanctioned, no changes will be allowed. A bank account is required, which should be jointly held by the principal and the co-principal investigator. After the installment is dispersed, we would representatives from university would be visiting the respective college to see what is the progress that is being done by, and we need a utilization certificate as and when we disperse the installments, because we expect you to spend the money and do the research in a timely manner so that we can release the second installments. We do not provide allowances for attending a conference or seminar unless a paper or poster is being presented. So please look to it that you present it, and we expect all the research projects to and culminate in a publication in a indexed journal. This is what we look for. And if there is a cost involved in a good index journal also, RGUHS funded for it. And if, as I told earlier, co-PI has to leave, the co-PI can take over if PI has to leave. And the project is not completed for any reason, then the parent institution will take the responsibility. Please ensure that while submitting the final report, you have completed all the tasks mentioned in your project while applying for the. I'm hurrying through because I have got a very short time. So I want to complete it before the time given to me. We have tie-up with a lot of institutions like IISc, NCBS, CCAM, and I'm very happy to see that many researchers from Ayurveda faculty have also undergone a training in nanotechnology from Indian Institute. These are new technologies which you can use it for developing new products. Then we also facilitate tie-ups in the projects. We provide 80% rebate in the fee. Government provides actually for ease of patenting, filing process and all. We also support it. We have a legal separate patent cell which will help you in getting the patents for the new products. Caution needs to be exercised while publishing and presenting a paper when you are looking in for a patent. Most of the people in Ayurveda especially have to take care of this, because if you are going into some new project, you need to look for how to patent it or something like that. Then please check before doing publications, because once your publications is done, patenting will have no value. So please take care of this. These are the important things which you need to look into it. Apart from that, a lot of things I think many people would have told you earlier, that evidence-based medicine also I feel. So always look into a research project evidence, so that in future also whatever Ayurvedic should be useful for the mankind. At the same time, nobody should raise any question mark over the quality or the side effects or anything. So please take care of all these things. I feel if you need, you can take help of all the laboratories which are available, or inputs from the physicians, consultants who are available, including allopathy. You can take it up, because I feel Ayurveda has got a lot of potential, provided we use it in the channelize it in the right way. We should have Ayurvedic formulations coming out everywhere. If you go to China and see, you don't find many medicines which are available over the counter, or medicines which are available. If somebody falls ill and he has not taken his medicine from his native country, then he will have to go in for only the Chinese herbal medicine, which are commonly available. We should reach such a state that we can formulate a policy where more people go into Ayurveda, because it is a known product which has been used over the centuries and documented also. Only thing we need to do is provide evidence to the modern naysayers who always keep asking questions. So I ask you to go into these things in detail and look into it. I thank for SDM for giving me an opportunity to be with you and discuss with you. I hope I have done justice to my time, what has been given to me. Thank you.
Thank you very much, sir. With the permission of the chair, although it's a keynote address, there is one question which has been put forward, sir, by a very senior Dr. Nandini K. Kumar, who was the former Deputy Director of ICMR.
Yes,
her
sir.
question, if on ethical grounds, if there is a change in the protocol, will the RGUHS allow that in a
Sir,
midway?
we have allowed it, subject to the clearance from the ethical committee. Unless and until it is necessary. We go back to the research project, what was submitted to us, we recheck on that, and if we feel that it is unavoidable, we need to do a change, we permit it subject to the approval from the ethical committee. You will have to go back to the ethical committee,
yes,
and
sir,
get their approval.
Thank you very much, sir. Once again, thank you for your valuable words and giving a clear insight of what Rajiv Gandhi University expects from the faculties in terms of the research proposal submission. Thank you very much, sir, for your valuable presence and being part of our institution's committee's program as a part of the Silver Jubilee celebration of the university. Thank you once again for being with us. Now,
Thank you for giving me the opportunity.
Now, moving on to the today's topic on research challenges in Ayurveda by renowned speaker Dr. P. Ram Manohar, Research Director, Amrita School of Ayurveda, Kollam. Though Dr. Ram Manohar do not need any introduction in the field of Ayurveda and research, but as we have more than 1,230 delegates from various other streams of medical fraternity like medical, dental, pharmacy, yoga, naturopathy, physiotherapy, I think I'll give a very brief introduction to Ram Manohar. Vaidya P. Ram Manohar received BMS and MD degree from Bharatiya University, Coimbatore and Rajiv Gandhi University of Health Sciences, Bangalore, respectively. He has been contributing in the field of Ayurvedic research for the last 29 years. He was the principal investigator on the Indian side of Indian Institute of Health USA sponsored research study to scientifically evaluate the efficacy of Ayurveda in rheumatoid arthritis. The outcome of this study was published in Annals of Rheumatic Diseases and Journal of Clinical Rheumatology and won the prestigious Excellence in Integrative Medicine Research Award from the European Society of Integrative Medicine. The study was recommended as a blueprint for future studies as SCAM by Dr. Edwards Ernst, a critic of complementary and alternative medicine. He has to his credit about 100 publications, including research papers published in various journals. Under his editorial leadership, Ancient Science of Life became the largest PubMed index research journal in the field of Ayurveda. He serves in the editorial board of Indian Journal for the History of Science published by Indian National Science Academy. He has been invited speakers at various prestigious institutions like Harvard Medical University, National Cancer Institute, NIH USA, University of Vienna, University of Denmark, University College London, and many more. He has been honored with Ayurveda Marga Pravartaka Award by L. Mahadevan's Ayurveda Foundation in the year 2014, Vaidya Sundarlal Joshi Smriti Shodhak Puraskar by Maha Gujarat Medical Society in 2015. He also received the Bharadwaja Puraskar Award from Uttam Ayurveda Ashram in 2016. In 2017, he was honored with Dr. C. Dwarkanath Memorial Award by ISTM. He has visited various countries for the propagation of Ayurveda. He is presently serving as research director as Amrita School of managed by Amrita University. He has also been faculty in various institutions that has been imparting courses and training in Ayurveda in various universities across the globe. He is a research advisor for in history of science for Indian National Science Academy, INSA, Government of India. He is a member of the Scientific Committee of National Institute of Ayurveda. He is a member of the WHO Expert Group for Development for International Standard Terminologies for Ayurveda. He served as member of Central Council of Indian Medicine, Government of India. He has served in the COVID-19 Task Force of Government of Kerala and also a member of the Interdisciplinary Ayush R&D Task Force for COVID-19 constituted by Ministry of Ayush. It is indeed our great pleasure, sir, to have you on today's occasion. Dr. Ram Manohar will be speaking on a very apt topic, Ayurveda research challenges in Ayurveda. Over to you, sir.
Thank you very much. Namaste. My thanks to Prasanna Rao sir, Dr. Suhas Kumar Shetty, and all the other organizers. I would also like to wish the chief guest today, Dr. Rajesh Shenoy, for being present here today. And I was happy to hear his keynote address, which was very informative. And all the other participants, it's a great pleasure to be here today and to share my views in the light of my own experiences in the field of Ayurveda. So it's also, yes, important to talk about challenges in research, because research is a field that is still developing in the field of Ayurveda. And even as we see that there are more and more opportunities, coming up, it's also important to anticipate challenges so that, we don't lose direction and we move in a progressive way. So today I will now move on to my presentation. So I hope my screen is visible now.
Yes, sir. It is visible and audible. Thank you, sir.
Okay. So just a second, I will approve. Yeah. So today's topic is research challenges in Ayurveda. And I would like to begin with a story. This is something which I have been repeating many times, but I still feel that this is relevant and puts things in a perspective. You know, Akbar and Birbal, we are quite familiar with this king and his minister. And Akbar used to give very strange tasks to his minister Birbal, who was exceptionally intelligent. So he said that, one day that you bring me the 10 greatest fools in the city. And this is something Birbal was getting very used to. So he said yes. And he said two fools are already listed. And that is, of course, the king himself and then the minister, the king for, always thinking up of these kind of tasks, and Birbal for following it. And he said the remaining 8 I will find out. So he got about 1 month, time to find out all the fools in his country. And Birbal was moving around, and it was, after all, not so difficult to pick up fools. Here was a person who was sitting on a horse's back and then, carrying the load on his head. So this Birbal was amused as he was moving around and identifying fools. And in the night, in that day evening, Birbal thought he will go out for some walk. And it was a full moon night, and he was just speaking to himself. Even 1,000 lamps would not light up the streets as the moon does today night. And as he was moving around, he found that somebody was frantically searching for something on the ground. And then Birbal asked, "What is it that you're looking for?" And after repeated queries, the man said, "I'm searching for my ring." And then Birbal had a look because it was a bright, night with the full moon. It was very easy to see on the ground. And Birbal couldn't see anything. And then he asked, "Are you sure that you lost the ring here?" And then the man replied, "Of course not. I did not lose it here. I lost it in the darkness, there in the dark place. But since there is no light there, I'm searching here." Now, I'm telling this story because, in my experience over all these years that I have done research, I have most often found myself in the place of that person who was searching for the lost ring under the moonlight, or in another version of the story, under a lamppost, and not, in the darkness where it was actually lost. So in my opinion, this story sums up, the current situation in the field of Ayurveda. We are doing a research. The biggest challenge is the perception within the Ayurvedic community of how research should be done on Ayurveda. Our research today is almost like searching for, the knowledge of Ayurveda in a place where it is more convenient to do so, but not exactly in the place we will be able to discover it. So this is the biggest challenge. We are using methods, we are using protocols, which may be convenient and easy to do, where we may be getting grants which may be more easily accepted, but it may not be able to actually advance the knowledge of Ayurveda. This is, in my honest opinion, the biggest worry that I have, looking back, to nearly 3 decades of attempting to do research in the field of Ayurveda. So let us very briefly have a historical overview of how research has evolved. The research in Ayurveda has started from the pre-colonial period. And let's have a very quick look at how it evolved. We can see that, the research basically started when, in the pre-colonial period, when the Britishers and the Western Europeans came to India, they had the first encounter with traditional medicine in India. And so they found a lot of practices, and I'm sure you know this first uh, you know, documentation of the nasal reconstruction in Pune by the Potter community. This was published in the Gazette in London, and this opened up, a whole thought process and led to the development of even plastic surgery in Western medicine. So this technique called as rhinoplasty, and then the practice of smallpox inoculation, which was prevalent in India even before, vaccination was discovered. So in this way, the first modern research, we can say, began in the pre-colonial times. And this period also, we found the documentation of Ayurvedic practices, including the composition of this work called Hortus Malabaricus by Hendrik van Reed. He commissioned this work, and a local healer in Kerala, T. Achyutan, actually, helped. And these fascinating diagrams of Ayurvedic medicinal plants have been preserved in the Netherlands in copper plates, and now the Kerala University has also printed these books. They are a very rich source of information about the medicinal uses of plant. Then there was Garcia da Horta, who wrote from Portugal, who wrote this first pharmacopoeia. So this was the first period of this discovery and research in Ayurveda. This was followed by historical, Indological. The second phase was mostly from a historical point of view. Indologists started studying about Ayurveda, and then there was anthropological research. And as an outcome, the most comprehensive work on the history of Indian medical literature is written by a Dutch psychologist, a scholar called Muhlenberg. This is in large volumes. And what is most ironical is that this volume is accessible more to the international audience than the Indian audience. It's very expensive. It's only in recent times, I think, that Motilal Banarsidass has even made an Indian version. But when I discussed with the Ayurvedic community, a lot of us are not even aware of such a work. So this is very comprehensive and very meticulously done. I've had the chance to also visit him and meet and discuss with him. Then we had the second phase. So here we found many other scholars like, Francis Zimmerman, Arion Rosu, Dominic Vujastik. These are all the kind of scholars who actually, worked on along these lines of historical, Indological, anthropological research. This was followed by another wave of research. This we can call as the ethnobotanical, ethnomedical research, ethnopharmacological research, where driven by this idea of bioprospecting. So from a historical point of view, this came to be more, Ayurveda was looked as a treasure house of leads from which new drugs could be discovered. So the discovery of reserpine from Rauwolfia, serpentine. It was around this time also that, from medicinal plants, a lot of new chemical entities and medicines were discovered also in different parts of the world. And this approach, we can see the most recent example which got highlighted globally is the discovery of artemisinin from Artemisia annua in Chinese medicine, for which, Yu Yu from China got a Nobel Prize. So that is the prospect of how new chemicals, this is another way in which research was driven. And then in India, we have our own, scientific enterprise for Ayurveda, like CCRAS was set up and research started to come, but mostly high-level research has still been driven by, people outside the field of Ayurveda. So we found the Nimitli initiative under Professor Mashelkar, in which a lot of modern scientists came into it. And later we are beginning to see changes in approach, the concept of reverse pharmacology, which was proposed by a reverse pharmacology approach. And then we have the person-centered medicine approach, the Ayurveda biology. So we have, now the CSIR having the Ayurgenomics, Ayurvedic biology, this initiative by Professor M.S. Valiathan. And now there is discussion of whole system research, network pharmacology. But if you look at this whole evolution of research, in Ayurveda, you can still see that the leadership is taken by people outside the field of Ayurveda. Ayurvedic physicians or Ayurvedic community themselves have mostly been engaged more in clinical medicine rather than in medical research. Even if there are research activities happening, especially in the PG or PhD programs or through CCRIs and such organizations, these are not, good examples of high-level thought leadership initiatives. Most of the time, they are kind of, just following the standard protocols and bringing out publications which are not having really a global impact. In fact, I don't want to sound very critical or very pessimistic, but there are some facts that we still do not have, high impact index journals coming from some of the major research institutes in the field of Ayurveda itself. The CCRS research journals are not indexed in big databases and things like that. So we can see that some of the leadership initiatives have actually been taken by modern researchers. And that has been, so what I wanted to point out is that when it comes to research in Ayurveda, the first imagery that I wanted to explain through Akbar Birbal's story is that we are looking in the wrong place. We are using perhaps the wrong approaches to do research because it is convenient. And we are not taking the trouble to bring the lamppost into the darkness where we really have to search for the knowledge. And the second thing, as we can see from this historical timeline, that research leadership in the field of Ayurveda has been from people outside. I mean, we have always been listening to people from outside the field of Ayurveda, from the modern scientific field, as to how research should be done in the field of Ayurveda. And we have been trying to follow, we have always been on the defensive. I don't say that this is wrong. It's not that we shouldn't listen to people from outside. But the thing is, we have still not been able to think originally. I mean, that is the biggest challenge. Can from within the Ayurvedic community, we give leadership to research. This is the kind of research that we need in Ayurveda. We can use tools, we can use all the resources that we need from modern science, we can collaborate, but then a research methodology or a research approach that is inspired from the epistemological foundations of Ayurveda, which is more suited, which actually brings the light into that area of darkness where we have lost the knowledge of Ayurveda, through all this passage of time. That is really lacking. And this is what I think is the biggest challenge. So now let us look at the time before. So I was now looking at just the research and how it evolved in, in the modern times. But if you look back, you can see that we can create a timeline of and the landmark achievements of Ayurveda as a whole system in what we can call as knowledge creation, although we may not be able to call it as research in the modern sense. If you look at research in the broad sense of knowledge creation, of knowledge validation, of systematization of knowledge, then in the Ayurvedic tradition also, we had a very rich, backbone of what we can call research in those days. So something in the beginnings, you can see zoopharmacognosy, even in the Vedic period, zoopharmacognosy or observing animal behavior and getting clues, of how medicinal plants could possibly be helpful. We can see this is probably a parallel to the animal studies today. Today, we are experimenting on animals directly, creating models of animals and then trying to get clues of whether a medicine will work or not. Whereas in ancient days, like in the Atharva Veda, it is so Varaho Veda Bheshad, and the Varaha knows the medicine. Nakulo Veda Bheshad, and the Nakula knows the medicine. So it's very clear that there also, we did get clues from animals. And we can see in the, Anna Raksha Vidhi, toxicity of food was tested on animals. So we cannot say that, toxicity studies, the use of animals as a precedent in Ayurveda. It's not a totally new phenomenon. So animals were tested for toxicity. Animal use, the way animals use herbs and other, resources in nature was very closely observed. And this is the way a lot of clues and information about the medicinal properties of plants were obtained even in those days. Now we see in Charaka Samhita 3000 years ago, there is a very elaborate discussion on chance effect versus real effect of treatment, which is today the basis of statistical significance. Pratiniyamiki Siddhi, when you give a medicine and a patient gets cured, Charaka asks the question, was your treatment really responsible for the outcome, or did it happen by chance? So just imagine 3000 years ago, they were talking about this difference. The effect of a drug versus psychological effect. Vagbhada tells in Ashtanga Hridayam, Nirmantre ka vaktir bhedokti shakti, a medicine which is nirmantra, does not have any psychological impact on it. Doesn't matter who gives the medicine. If you give Haritaki to anybody, it will cause anulomanam. So the effect of a medicine as opposed to the psychological effects that are produced, what today we call as a placebo effect, was discussed through this concept in so these kind of milestones, it's very important that we reconstruct this history of Ayurveda also, the key research developments that in the evolution of Ayurvedic medicine. I just received a message. Is there any problem? Am I audible?
Sir, you are audible, sir. Please go ahead.
Is there anything? I just saw a message. Is there anything I have to do?
You can carry on, sir.
No, okay. Yeah.
Answer
fine.
the questions at the end.
Okay. Yeah, fine. So, and then we have in the Ayurvedic tradition, these can all be put in a proper timeline. And actually, I'm working on this now. Cause and effect relationship as a basis for developing treatments, discovering properties of new drug sources, describing and diagnosing new diseases, developing treatment protocols for new diseases, formulation of medicine for challenging diseases, updating disease classification, pharmacopoeia, development of new theories. So I feel in my experience, and which is a project which I'm working on, that we can really construct on a timeline the great achievements in knowledge creation, in systematization of knowledge, in development and advancement of knowledge, all those activities which we would today call as research, we can consider that, that has been very well formulated. So, okay, the next slide. So what I wanted to point out is that the key challenge, as I was saying, that we need to develop a perspective for research from within the Ayurvedic thought framework. I showed this timeline only to say that we do have that potential for that leadership, for taking the research leadership from within the Ayurvedic community. We should be able to define what kind of research is needed, to advance the knowledge of Ayurveda, and how best we can use the tools that are available and that is developed by modern science. So we can engage in a dialogue with people outside the field of Ayurveda, but the methodologies have to be developed from within. So there are different approaches that we can see today in the field of research, extracting Ayurveda knowledge using modern tools of research, validating and applying Ayurveda knowledge on the basis of modern scientific knowledge. That's another approach. Enriching Ayurvedic knowledge with modern tools of research. That's another approach. Integrating Ayurveda and modern medical scientific knowledge. This is another approach. And research for self-validation and discovery of new knowledge applications from Ayurveda. So we can now categorize all the types of research that is happening today or can happen under these 5, broad headings. Now, extracting Ayurveda knowledge, this is the way most research is done today. You study something in Ayurveda, then you do all the modern kind of researches and convert it into modern knowledge. So this is how rhinoplasty became a part of modern, medical tradition. Reserpine was developed from Rauwolfia serpentina, artemisinin from Artemisia annua. So here the whole idea is that whatever fits into the modern scientific framework and understanding, we can extract, and it becomes valid evidence-based medicine. So this is the problem. We all agree that medicine should be evidence-based, But the question is, what constitutes evidence? Is evidence only what can be explained and validated through the parameters that is dominant today in the name of modern science? Can there be another kind of evidence? So this is what I also want to talk about, because I'm talking about, there are many other challenges. I can tell you research funding is a challenge. And yesterday, Prasanna Rao sir was telling that how much Rajiv Gandhi University is actually promoting research, giving even funds for, UG at the UG level. This is really quite fascinating and really a welcome move. When we were students, research, we did not get this kind of a patronage. So all this is extremely kind of fascinating, but those are kind of other pragmatic challenges that we face. I want to talk more about a fundamental challenge that we are facing is in choosing the right approach and the right methodology and framework for doing research. So this is the first methodology. So I'm showing these 5 types of research approaches so that we can identify and judge for ourselves what type of research, what category we would be falling under. The second thing is validating Ayurveda knowledge. Now, when you say ashwagandha for immunity in COVID-19, we have to explain or demonstrate how it is working. I mean, what molecule inside ashwagandha is going to interfere, with the cell entry of the COVID-19, the spike protein or the ACE receptor. So this kind of validation of Ayurvedic knowledge using modern scientific parameters. Now, why should we add turmeric and pepper? So now we explain that, there is piperin in pepper and curcumin in turmeric. Curcumin has very poor bioavailability, and when you add piperin, then the bioavailability gets enhanced. Now, these kind of explanations definitely do validate, practices in Ayurveda, but the problem is that they cannot explain everything in Ayurveda. So while they validate to some extent, many things which cannot be validated through this method may be missed. That is the challenge in this approach. So here, although the Ayurvedic practices may retain its identity, which will be lost in the first approach that I mentioned, where, Ravalfia Sarpagandha becomes Reserpin or Artemisia annua becomes artemisinin. Here, we still have the Ayurvedic practice, like combine a cereal and a pulse. It meets a complete requirement of essential amino acids. What an amino acid present in cereal, not present in a pulse. When you combine 2, we get both. So all the essential amino acids are available. So here we don't modify the practice we are doing, but we accept only those which can be explained through modern science. Now, using of hydroalcoholic extracts of herbs, how does it work? We'll come back later to that of the solid state fermentation and procedures like that. So this is the second approach to research that we have today. It has its advantages, but also its disadvantages, that all that we do in Ayurveda is not simple enough to be studied by these reductionistic methods. So if we follow only this approach to validate Ayurveda, we will accept many things, but we may also reject a lot of things which don't make sense from this framework, but which may still be useful. So the next thing is enriching Ayurvedic knowledge. Here, we are just adding on things from outside, like using a stethoscope to do the Shabda Panjendriya Pariksha, using a thermometer, standardizing raw drugs. Here, we are not tampering with our theories, but we are using these tools to enhance or enrich our clinical diagnostic and therapeutic experience. So we are able to assure that all the batch-to-batch confirmation is there. We are assuring quality assurance of Ayurvedic medicine, testing for heavy metals and pesticides. So we are not modifying the form of the medication, but we're just giving some quality assurance. So this is another approach, research for enriching Ayurvedic knowledge. So research for extracting knowledge from Ayurveda, research for validating Ayurveda, and this is now research for enriching Ayurveda. The next thing is a research to promote integration, because today this is a very big challenge. People are not able to treat with only one medical system. Most of the patients who come to us have comorbidities. They are already on some other medications. And while they are under Ayurvedic treatment, they have to go to an allopathic doctor, or an allopathic patient who is taking allopathic doctor, they have to come to us. So how can we leverage different systems, to maximize healthcare outcomes? So here collaboration and cooperation of allopathic Ayurvedic physicians are required. An integrative approach to research is necessary, where we define where Ayurveda can be used as a standalone, where it should be integrated. And there are three possibilities here: Ayurveda being integrated into modern medicine, or there is a mutual integration, or Ayurveda integrating modern medicine. Today, worldwide, the movement is that modern medicine is the basis and good practices will get integrated from other systems. And here, the only challenge is the identity of systems like Ayurveda may be lost in this process. So again, if that was the best outcome possible, then we have no issues. I mean, that would have been fine. But our worry here is that because modern medicine has a very narrow framework, if we validate everything just using that framework, and if you absorb Ayurveda into that system, we might lose, many aspects of Ayurveda, which can actually change the way we handle healthcare, change the way we look at human health, higher levels of health. So this is the thing. And then finally, we have another approach, which is the approach of self-validation and self-discovery. Ayurveda is validating itself on the basis of its own epistemological and ontological premises. So Ayurvedic profiling of new diseases. We attempted to do this for COVID-19. When a new disease comes, can the Ayurvedic community, come to an Ayurvedic understanding? There are so many diseases that need to be studied like this: multiple sclerosis, Parkinson's disease. We still do not have a very proper Ayurvedic profiling. We have only pragmatic approaches. We may broadly call them as Vata Vyadhi, or we may give a name as Kampavada. Multiple sclerosis, it's still not even very clear. So different physicians use different approaches. Whereas in Ayurveda, we do say that we have to profile new diseases. Ayurvedic profiling of new food articles. There are so many, our entire nutrition has changed in this modern era, and we are not able to come up with an Ayurvedic understanding of many of the food articles that we use. Similarly, Ayurvedic profiling of medicinal plants. Yet another big area of challenge is, when you want to assess objectively a patient using Ayurvedic parameters. We want to do an AMA assessment. We want to do an Agni assessment. A lot of attempts have happened in creating objective instruments, questionnaires, validated questionnaires. And in this area, unfortunately, we have not been able to make big strides, although I won't say no, it's not that no attempt has been made. But this is an area where we will have to really focus on if we want to bring forth Ayurveda as a self-validated, self-contained system of medicine. And here we cannot rely only on modern methods of research. So I generally believe that we should have an ideal balance of all these approaches. I am not in favor of only one approach against the other. In order that the full potential, our goal is to bring the full potential of Ayurveda to the world. So all these 5 shades of research will be necessary. And as you can see, if you look at these 5 areas of research, you can see that they are like a spectrum. As you move to the first category, there is more of collaboration required. And as you come more and more towards this other end of the spectrum, it's more focused towards within the Ayurvedic community. So on one side of the spectrum, the leadership is from the field of Ayurveda. On the other side of the spectrum, the leadership will be from the side of modern medicine. So here we have a kind of very healthy platform where there is an attempt for 2 systems, knowledge systems, 2 thought systems to come together, understand each other, know the limitations, and allow each system to grow, in the basis of their own epistemology. And ultimately, we need a framework for research where we have very pragmatic, practical measures of validity. Not that one system should be evaluated on the basis of the other. You cannot claim that unless there is an explanation given in biomolecular parameters or in a particular mechanism, only then it will be accepted as valid knowledge. There are a lot of new researchers, the science philosophers are beginning to think in a different way. It's not just the p-value or the statistical outcome that matters. The ultimate outcome is it really helpful, useful? Is it replicable? Now, I was very surprised to find recently Subhash Kak had written an article in which he says the reproducibility crisis of modern science. The challenges in modern science itself is kind of very of great concern. Richard Horton, the editor of Lancet, was stated that science is moving into darkness because majority of the studies that are published are not reproducible. Even modern science is facing a lot of challenge. And so in this scenario, we really need to look at research from an original Ayurvedic centric viewpoint. This, I think, is the most important point I want to make today. The biggest challenge is to bring an Ayurvedic centric approach to research. So now I want to illustrate using our COVID-19 situation, how this difference can be illustrated. Now, here is a thought framework for interdisciplinary research. If you wanted to do research on COVID-19, you would naturally be asked to think in this way. Now, in Ayurveda, do you have antivirals? Can we discover some antivirals? Means medicines which can interfere with the, viral entry. First, whether it can prevent virus from entering a cell. Then once it enters the cell, it hijacks the genetic material. Then it starts replicating. There is the replication phase. Then it ejects itself outside the cell, comes out to infect more cells. So antiviral medicines can interfere at any of these stages. So now the research question, when you look at research from a modern scientific framework, now all of us would start working in this way. Which of our herbs can interfere with antiviral mechanisms? Which of our herbs have immunomodulant activity? Again, we have to think in terms of innate immunity and adaptive immunity, T cells, B cells, and all these things. And we have to create a framework where we understand whether these medicines, what mechanism it works. Then we have another area where we can talk about symptomatic management because patients need immediate, attention. So with Ayurvedic treatment, can we manage fever, lower respiratory tract symptoms, GIT symptoms, upper respiratory tract symptoms, and then of course the comorbidities. So this would be the framework in which, if you followed the current method of research, this is the framework in which your research is likely to get supported and promoted. Now this is fine. I'm not saying this kind of research should not be done. But if you were to look at the Ayurvedic framework, there is another way to do this research. Okay, I think that slide is somehow missing. I'll come back to that. So if you were to look at it from an Ayurvedic point of view, then you can profile the disease. Can we also not do research in that way? That is my question, which might give a better outcome for the patients also. We should parallelly also think in that way. What is COVID-19 from an Ayurvedic perspective? Can it be classified under Jwara? If so, is it Agantuja Jwara? Is it then Sannipada Jwara or Vishama Jwara? Is it Bhuda Vishangita Jwara? What doshas are involved? What are the avasthas? Is there any Agandu avastha? Does the disease later become Nija? In which condition, these what they call as the cytokine storm and the immune overdrive, is this similar to the crisis that we see in Sannipada Jwara? So can these treatment algorithms, because this is very, very important, because COVID-19 is a very complex disease. It presents in so many different ways. I recently read a research article that was published from King's College London, where they have identified 6 clinical clusters for COVID-19. So each of these clusters, this means the disease presents in a variety of ways. And the stages or avasthas are also very varied. This is why we see such a wide difference in manifestation of COVID-19. So will not the Jwara algorithm-based approach of Ayurveda be more relevant? Why can't we also do research in that way? Do a clinical profiling of COVID-19 from the Ayurvedic perspective, and based on sound Ayurvedic thinking, we can develop different. I have interacted with many clinicians who are now treating COVID-19, and I find that their outcomes are very interesting. We don't need to say that we are going to cure COVID-19, but we do have a framework in which we can offer good clinical care, at the point of clinical practice. So this is the contrast, and this is the a gap that we need to synthesize, which I think is the biggest challenge in our times. And now I think there is, can I know how much time is left?
Another 10-15 minutes, sir.
Okay, fine. That should be fine. So here you can see that in Ayurveda itself, there is a framework of research. And this is my humble, proposal here, that this should become the foundation for future development of Ayurvedic research. We should put the ground very clear. It should be internal, an internalized approach to research in Ayurveda, where we adopt modern methods wherever relevant. We can go to all extent that is possible, but the core thought process should come from the Ayurvedic method of knowledge creation. So here you can see there are a lot of correlations. If you see in Ayurveda, we say Aptopadesha is the basis, Purvam Aptopadesha Jnanam. This is like literature review in modern science. From Aptopadesha, you get Jnanam, as Charakacharya very clearly says. A person who has acquired Jnana or the knowledge of Aptopadesha, he is a Jnani. So one who gets Jnana then should do Pariksha, which is through Pratyaksha and Anumana. Purvam Aptopadesha Jnanam, Tada Pratyaksha Anumanabhyam Pariksha. This is very similar to the method of, knowledge creation that we are following in modern scientific enterprise. So there are some similarities. That is why I say we also, Ayurveda is also emphasizing on evidence. Ayurveda is also emphasizing on validation. But what makes evidence? What constitutes validation? That is where there is a slight difference of opinion. In modern science, we follow very reductionistic, molecular-based, methodologies. But Ayurveda is much broad. Its epistemology is much broad. So unless we come to a point where we can redefine what evidence means in Ayurveda and demonstrate that this evidence is possible through methods that are original to Ayurveda, and we can supplement with modern approaches wherever possible, that will make all the difference. So I think somebody is annotating on the screen. And then, so Pratyaksha we can consider as observation, data collection, Anumana as data analysis and interpretation. And once this validation happens, this movement from Jnanam to Vijnanam is the process of validation. And then we have another beautiful person who has achieved Vijnana. Now he's translating it into practice. So a validated knowledge is brought into practice. That process is called as Yukti, this translation of, into actual practice. And a person who has translated this knowledge into practice becomes a Tantra Karta, or he documents, his experience. And this is how, and that Tantra becomes the Apatopadesha again. So this is the very beautiful method of knowledge creation, which is explained through the process of Ayurveda Avatarana itself. You can see this is the knowledge building cycle in Ayurveda. So we also have concepts of how to study this. I'm not going into the details. We have methods of observing. All of these can be translated into a research framework. And we don't have time to go into these details, but I want to quickly say that, we are through this process of data collection. This is actually a framework for data collection. If you look at it from an Ayurvedic point of view, how do we study the phenomenon, the experience around us? How do we categorize them? Is it something that's really existent or non-existent? If it is existence, what are we dealing with? Is it a substance or a property, or are we observing an action? Are we comparing the similarity and dissimilarity of two things? Are we studying relationships? How do we define all these things? This framework is there within the Ayurvedic tradition. So even for Aptopadesha, we do have very elaborate methodologies. And there's one thing which I want to highlight here is a methodology called Akshepa, which is refuting and questioning the statements mentioned in Ayurvedic text. So this was actually a method of validation. We have completely lost this process. We are led to believe that everything that is written in the text has to be believed as it is. But it's very clear, Chakrapani very clearly says that Shashvatatvam Artharupasya Ayurvedasya, na Shabdarupasya. Shabdarupa Ayurveda is Kritakatvad Anitvaram, whereas the Artharupa Ayurveda is Shashvata. So this process of akshepa means that when you study a text, pada, padacheda, padartha, vakya, vakyartha, once you get the vakyartha of a shastra, you are expected to do an akshepa, which is almost similar to this modern idea of falsifying what is there in the text. You are given the freedom to question the purva pakshas. You can try to falsify whatever is there in the Ayurvedic texts, and the samadhana to that akshepa is actually the proof of the validity of that statement. So the very method of review, it is studying Ayurvedic literature, Aptobadesha, is through this process of akshepa. This method has to come in, otherwise that critical thinking will not come within the field of Ayurveda. I think this is a very big challenge that most Ayurvedic physicians are facing. I've seen this in all the people who have come to me sometimes for guidance or sometimes in my own work. When it comes to Ayurveda, we always decide that the result has to be in favor of Ayurveda. The students are facing this challenge. They are sometimes coming and asking, can I give a negative outcome? I think this should completely go. We don't have to take it that an akshepa means necessarily disproving our shastra. It is actually initiating that process of critical thinking. Students should be allowed to do the akshepa of the Ayurvedic text, do akshepa of all the theories in a very open way, and then through the process of finding samadhana, we will be really able to establish the validity, and Ayurvedic theories will become actually more powerful. So this critical process needs to be really initiated. So there are many such frameworks. I just want to give a glimpse. Why don't we begin a research framework for Ayurveda from this perspective? This is my question. Because when you say challenges, you can point out 100 problems, but it's also important to indicate solutions. So in my talk, I'm also trying to point out where we can look at. Shastra, Yukti, Anubhava. This is a very nice framework in which you can work to create evidence. Shastra means there should be an authoritative guideline. This is one level of evidence. Yukti is evidence at the level of rationale. So this is almost like levels of evidence, from an Ayurvedic perspective. Shastra-based evidence, something which is documented, by authorities. That is one level of evidence. Yukti or rationale is another level of evidence. And Anubhava or actual experience is another level of evidence. So when you blend all these three things together, you have a very dynamic process of continuously updating Shastra, refining your Yukti, and then enriching it with experience. So these are all frameworks from within the classical traditions which can help us to create a framework for research. So even the bhava padarthas can be applied in research. And yeah. So Lakshana also, how do we define things? This is so beautifully explained in our classical texts. Ativyapti, avyapti, asambhava. When you characterize something, it should be really asadharana dharma pragashagam. This can be applied in diagnosis, in choosing treatments, in describing phenomenon, in defining things. It's such wide application. So when you define a disease, asadharana dharma, what are the unique identifying parameters of that disease? So it should not be avyapti. It should not be applicable to other diseases. It should not be, avyapti, which is not applicable to that disease itself. Ativyapti, it's applicable to other diseases. Asambhava, not at all applicable. So these kind of thought process is there within the Ayurvedic tradition. And another important thing is this distinction between chance and real effect. Yadricha siddhi and pratinamiki siddhi. Charaka says that just because you treat a patient and he gets better, it doesn't mean that you have done anything to heal the patient. Natra vaidyaha roga pramokshe karanam, says Charaka. The vaidya is not. So just because this we are seeing in the COVID-19 situation also, Ayurvedic physicians treat COVID-19 patients and we say we have cured them. I mean, in a disease which is almost 98% people are getting better, we have to be very careful when we say that we have cured, because this is what Charaka says. It could be just yadricha siddhi, or it could be that the disease is vinapi kriya swastham gachadam shodashamsaya. So this tarka of the treatment, why can you validate whether after the treatment outcome is observed, what is the rationale to think that it was your treatment that really worked? So I believe that this is a very important research approach that is necessary instead of randomized controlled trials. If Ayurvedic physicians should start reporting their treatment outcomes in a structured way based on Charaka's concept. I'll come back a little later, just before I conclude, to two models that have been proposed by some Swiss researchers, which comes very close to Charaka's methodology of research. Randomized clinical trials is not a way to test all the treatments that we have to offer in Ayurveda. What I want to point out here is that Charaka is himself told how we should validate our clinical practices. We also have ideas of how coincidence and causation can be distinguished. So coincidence is not causation. This is something which Ayurveda has been telling since centuries. So we have different terms. Sahacharya is coincidence. Vyapti is correlation. Causation is paramarsha. When you do an anumana, you are actually establishing causation. So in Ayurvedic thinking, we have ideas about sensitivity, specificity, that is avyabhijaritum, avinabhava sambandham. This is very similar to what we call about sensitivity and specificity. How sensitive is a test? How specific is a test? So this can be actually, framework. And in Ayurveda, we also have the idea of positive and negative controls. Paksha, sapaksha, vipaksha. Paksha is sandhigdha sadhyavan, a trial drug. You don't know whether it works or not. Sapaksha is a control, positive control, where it really works. And vipaksha is a negative control where it doesn't work. So before you arrive at a conclusion of whether something works, you need to compare it with a sapaksha and vipaksha. So what I wanted to point out here is that basic framework for doing research, for validating knowledge within the parameters of Ayurveda is laid out in our text. And this is the biggest challenge. Can from that spectrum of that fivefold research, we are more centered towards one side of that spectrum? Can we bring a shift towards the Ayurvedic centric research? This will completely change the way we do research. Other challenges are, of course, we don't have enough funding, we don't have enough resources, we don't have access, we don't have enough training in research. Even in this method of research, we need training. These are all the challenges that we are facing today. But the most fundamental challenge is what I wanted to focus today, is to initiate that thought leadership for research in Ayurveda. The Ayurvedic community should be able to say, this is the way research has to happen. Even while we are open to modern, I want to emphasize that. We can use all the tools that are available. These are all tools, but we must know where to use them and how appropriately to use them, and not lose the knowledge of Ayurveda in the process. Now I will, go to just one or two slides. One of the biggest challenges for Ayurvedic research is also when you come to drug research or understanding mechanisms. The Ayurvedic approach and modern research approach are totally different. In Ayurveda, we create super formulations, as you can see here. Single ingredients are combined to make simple formulation, 2 to 10 ingredients. They are again combined to make complex formulation. They are again combined to make a super formulation. Whereas in modern research, the whole design of even a research lab is to break down multiple ingredients to single ingredient, break it down into phytochemicals, fractions, single molecules. And then the whole system is designed to fractionate and break it into parts and study. So how can we ever understand how complex Ayurvedic formulations work together? There was a research scientist, Dr. Haridas, he's from the University of Kannur, and he was telling how some Ayurvedic methods of processing are complex, that they bring about changes in molecules, by solid state fermentation. When you make a gutika, when you do this, grinding over 30 days, a solid state fermentation is happening. And many of the chemicals are actually getting converted to a more bioactive form just through this processing. So unless we look at this whole complexity, so we need new methods of research. I'm just skipping these slides, like, network pharmacology, maybe, to understand this. So here is an example, piperine derivatives after solid state fermentation. So the piperine, which is there in that herb, pepper or long pepper, when we process it through the Ayurvedic method of, gutika preparation, where microbes also participate. So if you make it totally microbe free, if you make our medicines in a totally sterile environment, these solid state fermentation may not happen. So if we follow GMP protocols, we may end up making Ayurvedic medicine which are not as effective. So we need to understand what is the process. I'm also not against sterilization, but the processes, we must validate our processes first, understand why they mentioned a particular way of preparing medicines. And only after that is well understood should we make modifications. So pipeline changes. So this is so we are going, Ayurveda is, a framework which tells us how to move from molecules to molecular cocktails, and a new method of molecular combinatorics. If we were to reframe the Ayurvedic approach to pharmaceuticals in modern scientific language, we would say it's a science of molecular cocktails. And this whole methodology is a method of molecular combinatorics, which is quite complex. And unless we use our research to understand this complexity, we are, following the story of the fool that Birbal recovered. We are trying to make simple things simple by looking at one compound or one active principle. Now, the last point, I also want to say one difference. This here is an imagery which I have been using also quite often. The modern medicine is like, this archer on our left side. He takes aim at a very visible target and shoots. This is how modern medicine works. It's like a magic bullet. But Ayurveda, we are like Arjunas. We face a bigger challenge. When Arjuna had to get Draupadi, he had to prove himself. It's interesting, in olden days, men had to prove their worth to get a woman in hand in marriage. So here you can see Arjuna is struggling. Actually, there is a fish which is moving in a wheel. It's high at a certain height, and Arjuna has to look at the reflection of that moving fish in a vessel of water, and then hit the eye of the fish. So it's a moving target. Now, this is how an Ayurvedic physician has to diagnose and treat. We are like Arjunas. The avasthas are continuously changing. And we cannot see it directly. We see it only through the reflection of the doshas. We see it indirectly. And we have to anticipate this dynamism of the doshas and the avasthas and hit on the target. So the whole approach needed for Ayurvedic research is very different. So now I want to go to some of the, this is the last point that I want to say. There is a very interesting methodology proposed by some scientists in Switzerland, Bertrand Grass and his colleagues. And with that, I will conclude. These are two methodologies. One, he says, is that increase the rigor of observational studies. So this is a better way to generate evidence rather than randomized controlled trials. So in a study comparing OS with RTCs when applied to the same subjects, it has been found that if you design observational studies very well, then it is possible, to create the same kind of impact. So we have to choose. So these are the methods that he suggests. You can read in greater detail because we don't have time. You can use all the statistical methods, inclusion, exclusion criteria, and all those things can be used. This is a modified methodology, which is called as RTO. RTO is retrospective treatment outcome studies, as opposed to randomized controlled trials. Now, it's my humble submission that we should seriously start thinking of adopting such methodologies into Ayurveda. So retrospective treatment outcome study will look at the patient progress. It is done in an observational setting. It's not very expensive, but we can bring in rigorous measures and methodologies so that the outcomes are valid. So this is a model of a retrospective treatment outcome study. If you just Google these terms, you will get details. We don't have the time to go into these details, but I just wanted to introduce the idea that RTO, or retrospective treatment outcome study, is an alternative to RCTs. And then another one is called the CPO, which is comparison of prognosis and outcomes. If you don't have, a good control, you can use the prognosis of the disease as a control and then predict outcomes. This is another way which we can do. So these are all methodologies which enable us to generate more rigorous evidence without bringing in very costly or very complicated. We must understand that the RCTs were designed. Also, it suits the pharma companies which with very strong internal validity, one drug working in one mechanism. It's very much linked to this pharma culture. It's not always about knowing the truth. So researchers are beginning to understand that there are alternative methods of doing research. And I think this is again a model for this prognosis, comparison of prognosis outcomes methodology which is proposed. So this is in brief. I'm sorry I had to rush through some of the slides because it's always takes more time when we try to explain, and I try to bring in many things into this concept. But I think I made my point. In conclusion, what I wanted to say was that the biggest challenge that we have today is the challenge of doing the wrong thing, looking in the light, doing the convenient research for convenience rather than facing the challenge or looking in the darkness, facing the difficulty or the challenge in research. And then research is mostly led from outside the field of Ayurveda. The leadership is from outside. We need to make the leadership from within the field. And the Ayurvedic framework for knowledge building should be the foundation. Using that, we should try to reach out to modern researchers. We should collaborate. But I think it's time that the Ayurvedic community takes the thought leadership in research, and that will clearly define how Ayurveda will be in the post-COVID period, when the whole world is also getting reset. It's a good time to reset the way we do research in Ayurveda. So thank you very much for this opportunity, and I hope I was able to convey at least some basic thoughts to set the ball rolling. Thank you very much.
Thank you very much, Dr. P. Ram Manohar, for enlightening us on basic challenges that we have in the field of Ayurveda in research. Thank you. I think you have touched the most aspects of the challenges that we have, and also probably have told the possible solutions for these challenges also. There are a few questions which has been raised by the delegates and the audiences. I'd like to take few questions.
Yes.
There's a question by Dr. Rachana Bharadwaj, who says that always, especially in the field of Ayurveda, they say that people do not have this research culture or research skill. What do you suggest for the young budding doctors to become an active researcher so that they can contribute significantly for the future?
Yes, research is basically an attitude. It's not just, playing, fiddling in the lab with, test tubes. That's not what research comes from your mind. It's curiosity. It's, a search for seeking for knowledge. And the best way to nurture this in the education system, from the BAMS, students should be, I am a bit worried that modern methods of research are being forced into students in BAMS. I'm frankly not in favor of that. We should help them study our texts in a critical way. That is the first step. So that the research bent of mind is like Agnivesha asked Atreya at the end of the course, I don't believe what you said. How many Ayurvedic students will have that courage to stand up and question our own Shastras? That is what Vagbada is showing. That is what Charaga is showing, how a good student should be. I mean, Agnivesha is telling Iti Atraya, Agamaya, Artha Suktam, Tat Suktinam, Pesalanam, Atriptaha, Bedadinam, Sammado, Bhakti Namra, Paprachedanim, Samshayano Agnivesha. He's telling your treatment is not effective because I'm seeing people who are taking your treatment not getting better. Others who don't take your treatment are getting better. So he's really challenging Atreya in such a profound way. If that, because research is an aptitude, it is a seeking for knowledge. Once that is awakened, nobody can be stopped from being a researcher. That curiosity will enable them. So what we need is nurturing of research attitude. Otherwise, whatever facilities you give, whatever labs you create, whatever environment you create, nothing creative will come out. Because the science was created when no labs were there. Modern science was created when nothing was there. Thomas Alva Edison or Albert Einstein had no access to Harvard University kind of labs. Or in fact, today the productivity is very poor. We can see more and more resources coming, less and less the productivity. So it is time that we started thinking as human resource development is the most important aspect in promoting research. And for that, we don't need to spend much. Good thought process, good training in the BMS course. Let the students come out like lions, roaring and asking questions and seeking the truth, then research will completely change.
Thank you, sir. We have one more question by Dr. Pradeep Dua. Uh, Generally, we say that we would like to publish our publications or findings in good impact journal. But
Yes.
until unless we follow this RCT studies or any of the standard designs, the most of the reputed journals do not accept this. So what do you feel is a challenge and how to overcome this challenge of this irony of publishing using Ayurvedic way of understanding of concepts and putting forward?
Yeah, yeah. No, the situation is not really as bad as it used to be. Of course, there may be challenges in publishing in top journals like Cell or Nature. But I can tell you it's no longer difficult to publish in Scopus Indexed or PubMed Indexed or even journals with some impact factor. So many platforms have emerged. There is journals like European Journal of Integrative Medicine. Even Nature journal has scientific reports, which is not maybe at the top, but these journals are also beginning to publish studies on Ayurveda. The whole thought process is changing. So, but we have to do our homework. There are debates, like as I was telling, the editor of Lancet and New England Journal of Medicine confessed that they are being forced to publish articles, because of the pressure of pharma industry. So even these journals are beginning to get exposed. There is discussion and thoughts about mixed method research. So I'm quite sure that let us start by targeting, maybe the journals not at the very top, but at least Scopus Index, those who have some impact factor. There are many such journals which will accept Ayurvedic processes of thought process and these kind of researches. But we need some training on how to write and present it so that these journals can accept it. And I can show you so many examples of such research beginning to emerge. And I think this kind of research training should be given in the Ayurvedic community. We can even invite like people like Bertrand, Grass, whom I just showed now. We are in touch with him. He's willing to, help and collaborate. So if we can get their help also in the beginning, let them come and give us trainings, tell us this is the way you must do research, which is supportive of Ayurveda. We will also listen better. So that I think there are a lot of ways in which we can do this.
Thank you, sir. I think you have rightly pointed out that the training of the professionals are very important in any field of research. So there's one more question. Like there are many plants which have good therapeutic index, but we have challenges in including these new plants to Ayurvedic pharmacopoeia. So how can we overcome this challenge of including new plants to Ayurvedic pharmacopoeia?
Yes, I think this is a challenge which I also mentioned that so there has to be a protocol that we have to develop on how to adopt new plants into the Ayurvedic pharmacopoeia. So I did a review of research of the old literature, and I found that in Ayurvedic texts only about 1,400, 500. In the classical text only 600, 700 plants are mentioned. Whereas our acharyas have said, Jagatyeva manaushadam na vidyade kinchit dravyam. So I always ask the question, why they choose only 600 when India has 14,000 medicinal plants? Why couldn't they discover more? They left us with only 1,500 and gave the statement that Nadeshu, Shaileshu, Sarassu, Chavi, Vanyeshu, Aranyeshu, Tathasrameshu, Sarvatra Sarva Parimargidavya, Sarvatra Bhumi Vasuni Datte. On the one hand, so this is the thing is it takes time for these plants to be studied. I tried to find out how long it took for a new plant to be introduced in Ayurvedic tradition. So it takes at least 25 to 30 years before a new plant, minimum. Sometimes it has taken 100 years for a new plant to get accepted in the Ayurvedic tradition. It's because we had such a strict criteria. Ajnadam aushadam na prayojayet. Only Jnadam aushadam should be used. So that gap between Ajnadam and Jnadam requires a long, study. And these methodologies can be created. Today, a modern drug is studied in 13 years. If you look at the Ayurvedic method of studying drugs, you need at least minimum the double time of that. At least 25 years is needed to. Are we studying plants so closely? We are not. Most of the time, our researchers in 1 year of their PG program or in 3 years of their PhD program, they want to get the plant accepted. So it is because of this myopic vision. If we have collaborative work between institutions and, which is long-term research. Long-term research is generally lacking in modern environments because it is not easy to get funded. This is the problem. The research enterprise, the research system is suffocating. When Thomas Alva Edison or Galileo or Newton or Einstein were there, these institutions and regulations were not there. They could think freely. If they wanted to study something for 20 years, they could study that. But today, it's not possible. So especially long-term research is very difficult to do. And to incorporate these new plans, we need long-term research. So cooperation of Ayurvedic institutions. We are not doing that. Even in one institution, PG scholars should cooperate. They take one plan, study different aspects of it. You could have inter-institutional collaborations. Another institution can study another aspect of that plan. If we plan in that way, I'm sure that we can, deal with these challenges and start incorporating, new substances, because they all have folk use or they are used in some other parts of the world. Some information is already available. We just need to, do further observations. And so I think if we bring in that framework, definitely it should be possible.
Thank you, sir. We have still many more questions, but due to lack of time, we will end today's session. I thank all the participants for their valuable participation and putting forward their questions. I'm sure we'll try to get back to you with the inputs from the experts. Now, may I humbly request our beloved principal, Dr. Prasanna Narasimha Rao, to kindly give a comment on today's session. Over to you, sir.
I think Dr. Suhas, I think we have Dr. Ramesh Devala, sir, who is also the Director General of CCRS, and he has a question, and I think we request him to throw light for 2-3 minutes. If Dr. Manohar, Ram Manohar.
Sir.
Yes, sir.
Yeah. Dr. Ramesh, please.
Yeah. I request
nice
Dr. Ramesh to kindly.
Ramesh, he's throughout all the programs, he's very in time and watching our program and giving suggestions.
Yes.
Great, sir. Thank you, sir. Nice to see you again. Nice to see you again, sir.
Yeah.
Thank you so much, Dr. Prasanna and Dr. Ram Manohar. Indeed, it's a visionary talk. Am I audible?
Yes.
Yes, sir. Yes, sir.
I'm audible, yeah. It's a visionary talk. Ram Manohar is always a gifted orator. It is a gifted orator. First, I must congratulate him. So, what is still in my mind, there is an impatience, really. We are in we have seen the research scenario nationally and globally on Ayurveda or herbal medicine, alternative medicine. Still, we are in the stage of validating our science to some extent. But as on date, still the controlled blinding, randomization, these are the key words in the research. Ramana has put forward many newer thoughts, which are really welcome. But still holds the key is the rigorous modern research methodology, which enables us to disseminate our publication in the international journals. For example, Dr. Valyathan's, so far till date, Dr. Valyathan's brainchild on Prakriti genomics, which has been published in the PNAS. To my mind, how many revisions it took, because I was on the monitoring committee at project. I know how many revisions it has to go at paper. We can publish only if we strictly adhere to the rigorous modern research methodology. There is no alternative to it. That's only the people. And many research findings are flawed. For example, right from starting from the sample size to the standardization to the study designs, there are many, many issues in the research which are needed to be addressed. So this is my humble submission. There is no way out for us as on date. For example, if we do any clinical research with very small size, sample size, strict research methodology that cannot be made generalizability. Generalizability in a sense, our findings cannot be put into practice by the clinicians. This is the ultimate goal for any research in any medical science. So there is a need that our research findings ought to be brought to the clinical research. That's applied research, ultimate goal. So Manohar may throw some light on this.
Oh, yes, sir. I agree that we need rigor. As I said, there is no question that we need evidence, that we need rigor. But what I wanted to point out is that even in modern medicine, RCT is slowly being dismantled because I was involved also in an RCT design study funded by NIH. So we were perhaps only, yeah.
Daniel first, yeah, I know.
Daniel first, yes. And that also got published in Annals of Rheumatic Diseases, which has an impact factor of more than 11 or 12 now. So that was a big thing for me. I never imagined that we would be associated with the paper. With that, that was because we were able to collaborate and all that. But I have been discussing with a lot of modern scientists from the West. So they are saying, yes, rigor is needed, methodologies are needed. But what method is more suitable for systems like
yes, we are stuck up there. We are stuck up there. Yeah. We are stuck up
because we are blindly adopting. Yes, because we are blindly adopting RCT designs.
We are not able to. So we are stuck up there. We are not able to come out because Nimitli project has nothing come out of it. So-called interdisciplinary works, they have nothing came out of it. Neither no drugs are adopted, no treatment protocols are adopted. Every Ayurvedic clinical practitioner is following the text since what I studied in my BMS. So we are stuck up.
So that's there. What. Yes, sir. So that's why I think these alternative models should be actually, explored. And many of them are more suited for Ayurveda. We can make it rigorous clinical practice outcomes research. And instead of trying everybody trying to do randomized control trials, is very expensive, very time consuming. And we can do that once we have made some good foundation, some specific areas we can do RCTs. But now PG scholars, PhDs, in that short period of time, they're being forced to do this kind of research, which is not resulting in any good productive outcomes. That is my only opinion, that we should avoid. And if we are doing RCTs, it should be planned well, as you said, with proper rigor, proper design, study design, so that, because you rightly said, most of the reviews of previous systematic reviews are pointing out a lot of methodological flaws in Ayurvedic studies, which is why they are getting, dismissed. So, but if we do good clinical practice outcome studies, there is practice-based evidence concept. These things should be worked upon so that, we can build a body of evidence that will be quite solid. And on top of that, we can also do RCTs and other things in the future, but that will be better planned if we do this groundwork. That's my feeling.
I think I'll take half a minute. Some of the national leaders in this field should take a lead and convince the Ministry of Ayush for a long-term studies and some kind of risk-taking projects, long-term projects we should visualize and implement in the country. So that at least results will come, say, after 10 years. Doesn't matter. But that policy has to come. The national core group should be formed to this.
Thank you, Dr. Ramesh.
Thank you, sir. Thank you so much.
Given insight. Dr. Ram Manohar, we are all grateful to you. You have taken us rather an insight how to go ahead with the research, especially the young scientists. The interest, involvement, and total inquisition towards research definitely will make more and more researchers get into the research from Ayurveda field. And we are sure that tomorrow will be better than today. And your all the insight what you have given to our young doctors, they come up with the green colors by tomorrow. I also thank Dr. Ramesh for your inputs. And we have Dr. Nandini Kumar, who will be speaking to us tomorrow. We have Pradeep Dua. He also posed some questions. No, it's very interesting. Many of no, the scientists in the field of Ayurveda are looking towards you to come out with some good protocols and protocol for the research. And the young doctors, especially in the collegiate, they are mostly concerned with their completion of graduation or post graduation, and the research with we the teachers should show the torch. And I'm sure the day to comes by the support of government and private agencies, more number of researchers will come forward. I'm very happy that Rajiv Gandhi University of Health Sciences, on behalf of this 10 days program is going on. Government of Karnataka as well the Rajiv Gandhi, through Rajiv Gandhi University, it is supporting all faculty of there are 800 institutions under health science institutions under Rajiv Gandhi University, and to the tune of around 20 crores. It is supporting for teachers, and now it has started for young undergraduates, and now the Association of Indian University also come forward to have integrative research, interdisciplinary research, right? Motivating the teachers and postgraduate students. I'm sure the day to come, right, in the future days, under your guidance, we will do lot of things. And you have given a great input to me also, that we have 3 institutions of Ayurveda, natural, and of naturopathy and medical college and dental college. We some of the research, right, can be shared with other sister concerned institution, that we will be taking forward by your advice. And you happen to be our the member of governing council too. We didn't have meeting shortly, so looking forward your more advice and collaboration. Thank you very much on behalf of organizing committee. I also recognize Dr. Baswati Bhattacharya. You're working in Manipal Institute, and you will also join with us for the growth of Ayurveda. My high appreciation for Dr. Suhas Kumar Shetty and his team for taking forward this sharing of knowledge among the community of medical sciences. Thank you very much.
Thank you very much, sir, for your valuable guidance throughout. I think you have been always our guiding source in all our endeavors. Thank you very much. Now I take this opportunity to thank the keynote of today's session, Professor Rajesh Shenoy sir, for highlighting the importance of research and what the Rajiv Gandhi University experts expects from the faculties and students in the area of research. We thank on behalf of the organizing committee. I express my gratitude to our resource.
Yeah,
not audible, Dr. Suhas. There is some problem, I think. On behalf of organizing committee, I take opportunity to thank Dr. Rajesh Shenoy. Is a great opportunity for all of us to listen to you. You have highlighted all the steps of to be followed, and rather the expectation
So I once again
of the university. That's take forward.
Yes, sir. We are very thankful to Rajiv Gandhi University for supporting our event, and we thank our President Dr. D. Virendra Hegde and the entire management for ever supporting. And immense thanks to our beloved principal and the entire committee of the E Samshodhana for this wonderful sessions. Special mentioning of a few of the committee members. If you are able to see the uninterrupted and regular following of the various sessions, it is because of the efforts of Dr. Girish KJ and CN Moose. And all the registration forms, feedback forms, documentation was taken care by Dr. Harni and Dr. Janaki. Dr. Sushant has been working day and night for the registration and answering the queries of all the participants. The colorful, informative brochures and banners and providing the links were taken care by Dr. Nataraj and Dr. Amarnath HK. So it was the entire teamwork by the guidance of our beloved principal, which has made this seminar a great success. So once again, I thank all
tomorrow's program.
Yes, sir. So tomorrow's keynote address will be by Dr. S.K. Banigold, who is the Dean Faculty of Ayush, RGUHS Bangalore. And the resource person is Dr. Kishore Patwardhan, Professor, Department of Kriya Sharira, Institute of Medical Science, BHU, Varanasi. And the topic for tomorrow's session is selecting journals for publication in UGC care. So this will be the session. So I request all the participants to kindly join in the same platform with the same link which we have provided and in the same time of beginning at 3 o'clock. I request all of you to kindly join at 2:45 and the session will begin exactly at 3 o'clock. So with these words, and I once again thank all the participants and especially all the speakers of today's session and the keynote address for today's who has made this program a grand success. So once again, on behalf of organizing committee, thank you one and all. So with this note, we'll end today's meeting. Thank you one and all.
Namaste, sir. Rajesh, sir. Dr. Manohar, thank you very much.
Sir, thank you for the invitation. Thank you.